Hello, welcome to another video of our Facts Only series. Today we'll discuss vitamin A. I'm Dr. Mohammed Tinawi. You can find more about my background in the description below. We'll discuss the chemistry, function, dietary sources, deficiency, recommended daily intake, and finally therapeutic uses and toxicity. Vitamin A is a fat-soluble vitamin. There are four of them: A, E, D, and K. There are two forms of vitamin A: provitamin A, carotenes. This is found in plants. Mammals metabolize provitamin A or beta carotenes into vitamin A, into active vitamin A. Or you can have a preformed vitamin A. This is the most active form of vitamin A. You find that in animal sources and supplements. Examples of that are retinol, retinol, retinoic acid, and retinol esters. Examples of dietary sources of vitamin A: first, plant sources where you have beta carotenes or provitamin A, carrots from the name, of course, butternut squash, sweet potatoes, green leafy vegetables, cantaloupes, red peppers. Preformed vitamin A, an important source, is supplements that people take. Also, you have kidney, liver, dairy products, egg yolk, tuna, salmon, etc. What happens if you are low on vitamin A, if you have vitamin A deficiency? Number one, dry eyes. And this is serious. This is not just dry eyes. This can progress into real eye damage. Night blindness, when people cannot see well during the night. Poor bone growth, especially in children. You can have hyperkeratosis, which is thickening of the outer layer of the skin. And finally, immune system problems. Vitamin A is found after obesity surgery or bariatric surgery in people who are malnourished. You can find it a lot in children in countries where malnutrition is common, and in people with fat malabsorption, such as people with pancreas problem, Crohn's disease, short bowel syndrome, celiac disease, also cystic fibrosis. Now, vitamin A is a fat-soluble vitamin. If you take too much, you are going to have toxicity. The recommended daily intake, and this is now expressed as retinol activity equivalent. So 1 microgram of retinol activity equivalent equals to 3.3 unit of vitamin A. So in males, it's 900 micrograms, females about 700 micrograms, in pregnancy 750 micrograms, and in lactation 1300 micrograms. The maximum daily intake that is safe is 3,000 micrograms. Above that, chronic use will lead to toxicity. So what are the symptoms of toxicity? Bone and muscle pain, including osteoporosis, liver toxicity, problems with cholesterol or dyslipidemia, ataxia, which is problem with gait, with walking, and alopecia or hair loss. Now, toxicity usually happens when people take supplements, or if they're taking a lot of preformed vitamin A from animal sources. It's unlikely to result from provitamin A because the organism or humans will turn it slowly into active vitamin A. So it's very hard to get toxicity, say, from eating too many carrots. It's important to know that retinoic acid is teratogenic, meaning it caused problems with the fetus in the first trimester of pregnancy. Vitamin A is used therapeutically in many children with measles, especially in countries where deficiency is common. Retinoic acid is used, retinoic acid is a form of active vitamin D, is used in many skin disorders. For example, isotretinoin is used for acne, again, very teratogenic. It can never be used in pregnancy or in women who are likely to become pregnant. You need strict birth control method. And although vitamin A is an antioxidant, randomized trials did not show benefit in coronary artery disease. I'm going to end here. Next video, we'll talk about vitamin E.